Bismillahirrahmanirrahim, WBC functions, and in this lecture we will discuss these four functions of WBC. The four functions, the first one is the amoeboid motion, the second one is diapedesis, the third one is the chemotaxis, and the fourth one is the phagocytosis. The first function, WBCs produce in the bone marrow, circulate in the blood, and when needed become part of the interstitial fluid. There they are not static but moving all the time by amoeboid motion at a velocity as greater as 40 micromillimeter per minute, several times greater their own length. If you will take the length of the WBC and the distance covered by the WBC travel in tissue in 1 minute is 40% of the size of the WBC. See it in this. Suppose this is the distance covered by the WBC, which is 40 micromillimeter, and if this is the size of the WBC, this distance is 40% greater than the length of the WBC. You can see here that white blood cell and the bacteria. The white blood cell is running after the bacteria and engage it and engulf it, and in this way digest it by its digestive enzyme and kill the bacteria and then remove it from its cytoplasm. Diapedesis, which is actually performed by the WBC. And the second function of white blood cell is diapedesis. The blood vessels are lined with the endothelium. These cells protectively, and that doesn't allow the migration of these cells outside of the circulatory system or outside of the vessel wall. However, injury or trauma can cause white blood cell to migrate across the endothelium, and this process of migration across the endothelium is called diapedesis. These cells are tightly joined with each other and they don't allow the WBCs, but in condition when there is its need, the endothelial cell give space to the WBC and allow them to come out from the blood into the interstitial fluid, and there they perform their activity. As a result of diapedesis, when this diapedesis occurs, the white blood cell come out. White cell become part of the interstitial fluid which surround the blood vessel and the tissue cell of the body. The white cell after diapedesis fight infection in the tissue and surrounding blood vessel. The blood vessel themselves provide a built-in pathway for diapedesis to occur when needed. There is a built-in pathway for diapedesis when inflammatory signals came from an area where infection is present. That signals activate these cells, and these cells there is a built-in mechanism in these endothelial cells which cause diapedesis. What is that inbuilt mechanism? In the endothelial cell, we have a protein which is called p-selectin, and it is produced. Normally it remains in the cell and doesn't express on the cell wall, but when there is infection, so this p-selectin is appear on the surface of endothelium. The other factor is platelet activating factor. This factor also appear on the endothelial surface. And the third protein is ICAM. It is intracellular adhesion molecule. ICAM is intracellular adhesion molecule. This also appear on the surface of cell. And the third, these are the three proteins which are present normally in the endothelial cell, and when the mechanism of diapedesis need activation, these proteins are activities are appear on the surface of endothelial cell. The P-selectin, the platelet activating factor, the ICAM protein. On the other hand, we have the WBC, and also on the surface of WBC there are oligosaccharide which is present on the surface of the WBC. There is a receptor which is also present on the surface of WBC and called platelet activating receptor. There is another protein on the surface of WBC which is called integrin protein. This is the inbuilt mechanism in which all these proteins are involved. On the endothelial side, P-selectin, platelet activating factor, and intracellular adhesion molecule ICAM. And on the WBC side we have oligosaccharide, platelet activating factor receptor, and integrin protein. When the white blood cell slow down, then it is bring close to the endothelial lining, that make it attach to the endothelial lining, and in the last allow them to escape through the gap spaces created by this built-in process. This widening is due to the presence of chemical that the body produces in large number during an infection or trauma injury. When this mechanism is activated when there is trauma or infection. Normally these cells flow with the stream of the blood, but when infection occurs, the first effect is that these cells come near to the surface of the endothelium. This is called margination of the cell, and the second effect is the flow of these cells are slowed down due to the activation of this built-in mechanism by the endothelial cell. These cells become slowed down and then attached to the protein which are present on the surface of the WBC, and protein which are present are produced by the inflammatory signals on the surface of endothelium, and the reaction between these two types of protein cause widening of the endothelial space and allow the WBC into the interstitial fluid. Animation, you can see the WBC, and this is the blood. It flow in the blood. When the blood flow with the same speed, these cells also flow with the blood. When infection occurs, this infection causes margination and movement to become slow down the movement of the WBC, and then due to activation of the inbuilt mechanism, it becomes part of the interstitial space. Now see in detail, this is inflammatory signals produced. So this is the inflammatory signals reach to the endothelial lining, and the endothelial lining produce P-selectin and platelet activating factor. The WBC become slow down. It has a oligosaccharide on it. This oligosaccharide come in contact with the P-selectin and further slow down its movement. The next step is another receptor, which a platelet activating factor receptor on the surface of WBC. One is the oligosaccharide and the other is the platelet activating factor receptor. When receptor attached to the integrin protein and they are activated, and when they activate, further movement of these protein, they actually attach with the ICAM, and when this integrin protein and ICAM molecule combine with each other, a space produced in the blood endothelial cell, and this allows the cell outside of the blood into the interstitial fluid. You can see that now the blood is coming out of the interstitial fluid. So chemotaxis. Many different chemical substances in the tissue cause WBC to move towards the source of the chemical. This phenomena is known as chemotaxis. When these WBC come out of the blood vessels, they move towards the source of infection where chemicals are produced. These bacteria, viruses, or fungus or any other toxic material, they contain toxins or chemicals which attract the WBC, and these WBCs into the high concentration area where the inflammatory chemicals are present in, or chemotoxic substances are present in high concentration. This movement is in the direction of high concentration. This is called uphill movement of the WBC against the concentration gradient. They travel there. Now we know that there are two things. One is the bacteria, which has by itself toxic substances. The viruses have toxic substances on its surface, and any invader agents which cause infection have toxic substances on its surface. And the second mechanism is this: when they damage or cause inflammation, due to inflammation, toxic substances are also produced, and that is the area which is then attacked by the WBC. This phenomena is called chemotaxis. Now the third function is phagocytosis. This is the most important function of white blood cell, which means simply cellular ingestion of offending agent. Phagocytosis is mediated by macrophages and polymorphonuclear leucocytes. Phagocytosis involves the ingestion and digestion of the following microorganisms, insoluble particles, damaged or dead cells, and activated clotting factor. So there are several stages of phagocytosis. The important stage in phagocytosis, the most important function of WBC is phagocytosis, and there is the process of phagocytosis in cell actually form pseudopodium. These are finger-like projection. When the WBC rich bacteria and project finger-like structures from its cell wall, and it acts around the projection from the membrane of the WBC occur, it surround the bacteria and take this bacteria inside the cell. When it is taken inside the cell, the membrane portion which cover the bacteria is detached from the cellular membrane of the. Now this pouch contains the cellular wall of the leukocyte, and inside it is the bacteria. So the combination of these two is called phagosome. This cell granules, and these granules contain lysosome. When the phagosome is engulfed or bring inside the cell, these granules release the lysosome and added into the phagosome. Addition of the lysosome, this is called phagolysosome. This lysosome is digestive enzyme in nature. It attacks on the bacteria and digests the bacteria and convert it into soluble debris, and then the cell remove this soluble non-toxic debris from the cell by exocytosis.